In this video, we'll be talking about whether a breast lift can be combined with breast augmentation and breast reduction. Now, this is a very common question asked in my practice. Doctor, whether I will also be achieving a lift with my breast procedure. Now, when we come to understand what is breast lift and why is it required, when we talk about breast sagging, basically the nipple position is down and that is what we call as breast sagging. The volume also reduces in some women after pregnancy, after breastfeeding, and as a natural process of aging as well. So obviously breast lift should be a very important part of whatever we do, whether we do a reduction or we do an augmentation. If some amount of lift is achieved, then it is always a plus. Now let us talk about breast augmentation with breast lift procedure, also called as augmentation mastopexy. When we are dealing with very low volume breasts but not saggy, then a simple augmentation procedure, whether it is with implant or fat, can also give us the lift procedure, and we do not need any lift procedure separately. But if we are dealing with saggy and low volume breasts which are also loose, then we should definitely combine a breast lift along with the augmentation. Now let us understand this further. So what we are dealing with is loose and saggy breasts which are low in volume, and that is why we have opted for increase in size. But if we don't do a lift procedure, what will happen? The implant that we place will be located above and the breast will still be hanging. And that is what leads to a double bubble appearance, and it is not so aesthetic to look at. That is why we need to combine a procedure which lifts the nipple or the whole breast on top of the implant where we have placed the implant. Because if we don't place the implant in the right position, then it can lead to or add to the sagging that is already present in the breast. That is why this judgment has to come from your surgeon whether a lift should be combined or not. In many cases, we are dealing with an intermediate stage where the sagging is not too much, but the volume is also slightly less. In those cases, what will happen that when we use an implant, the implant itself will provide a certain amount of lift and the patients are generally happy. But going further, what will happen that as aging will progress, the breasts will continue to age and the breasts may drop on top of the implant. That is why we need a breast lift procedure sometimes later on, a few years later after the implant procedure also. But again, see, in all plastic surgeries, as I've already said, that it has to be tailored to the patient's needs. If the breast volume is not sufficient but the tissue is tight, we do not need a lift. If the breast volume is low but the tissue is extremely saggy or advanced sagginess is there, then we should combine a lift. Not combining a lift procedure will be a mistake that we may need to correct later on. Now let us look at reduction procedures. Well, in reduction procedures, the way we design the reduction mammoplasty or reduction breast surgeries, in that design itself, a breast lift is already incorporated. A lot of times questions are asked by the patients that, doctor, is only liposuction possible for breast reduction? It is possible, but in a very select group of patients, because you should understand that in liposuction, what are we doing? We are basically making a tiny hole and through that we are sucking out the tissue or the fat generally. So when we are sucking out the fat and not actually recreating a new envelope, a tighter envelope, then what will happen? It will lead to sagging later on, and that is what we don't want. And that's the reason why reduction mammoplasty has to be a proper reconstructive procedure in the proper design so that it gives you a reduction of your breast as well as better nipple position. So all in all, what is breast lift? Breast lift is basically aligning the nipple position to the new breast shape and also at the same time increasing the size in breast augmentation, reducing the size in breast reduction. It's as simple as that. So as I've already told, and I cannot overemphasize this, that the expertise of the surgeon is very important in this whole journey of transformation in breast surgeries, because your surgery has to be tailored to your need and a lift should be incorporated wherever it is necessary, because that is the golden period where you can have the downtime combined for two procedures in one only, and you need not go for any additional procedures later on. I hope that this video will clear a lot of doubts about breast lift being combined with breast augmentation and breast reduction. This is actually a very, very common question which we get in our emails, in our YouTube comments, and also asked by patients in the consult. So I thought that this video would be useful. If you found this information interesting and useful, please do share it with your friends and like the video. Also, subscribe to the channel SB Aesthetics. We keep posting a lot of information about plastic surgery and skin treatments as well. Do keep the notification bell on so that you can get notification for the new videos. Thank you for watching.